healthcare is at a tipping point. If you think about healthcare over the past 10 years, people really haven't been focused on truly differentiating themselves and trying to figure out how do we make a real impact. It's been about mostly cost reductions, cost transformations. But now we're hitting a point where healthcare does need to transform for a couple of reasons. One is I think people are starting to realize that as patients, right, we expect more from our physicians and for our hospitals. So patients are now more financially liable for their healthcare, and thus they're going to expect more in terms of customer service. So I'll give you a great example. When a patient tries to call to schedule a ticket for an airline or try and book a hotel room, they expect good customer service. They expect that someone's going to be able to pick up the phone and allow them to book that appointment right there. That doesn't work in healthcare. What happens in healthcare is you're not sure what number you need to call. When you call the number, no one picks up. If someone does pick up, you're often transferred a number of different times before you can actually talk to someone. And then when you do get the appointment, you have to wait 20 or 30 days before you can see an actual physician. To me, reimagining healthcare is, what if there is a world where the patient does not have to pick up the phone to schedule an appointment? What if they can just go on their computer and schedule an appointment just like they schedule a hotel room or a restaurant reservation? That's what reinventing healthcare means to me. And according to our research, right now, about 2% of all medical appointments are self-scheduled, meaning the patient can go online and actually schedule the appointment themselves. We think by 2019, over 60% of patients will self-schedule appointments because they want to be able to self-schedule appointments. Now, the question is, will hospital systems, physicians, offer that capability by themselves, or will a third party come in the door and offer that capability on their behalf? I was meeting with a chief of dermatology for a major academic medical system, and we had looked at their access, and on average it was taking longer than 20 days for a patient to see a dermatologist at this specific hospital system. So I sat down with the dermatologist and I was reviewing some of the data, and he looked at me and he said, "Dipak, that's silly. If someone needs an appointment, all they have to do is call my cell phone." And my response is, well, when I schedule an airline ticket, do I call up the pilot to schedule the airline ticket? No, that's not the way the world works. Not everyone knows your cell phone number. So oftentimes, I think there is a little bit of a misperception. I'm not sure that from a provider standpoint, they truly understand how difficult it is to actually access and see them. But that's part of what we help them do, right? We help them figure out, how do you track the right types of data? How do you make sure that your physicians realize how hard is it to access your services? And that's really the beginning part of the whole change management process. Once they realize that there's an issue, and the way you get them to realize there's an issue, you get them to see the data, then they start to try and help figure out, how do we improve access?